Marek's disease, a highly contagious viral disease affecting chickens, was first identified in 1907 by Joseph Marek, a Hungarian veterinarian after whom the disease is named. Marek's disease is caused by a herpesvirus and can lead to tumors in various organs, paralysis, and death in affected birds. It has been a significant concern in poultry production worldwide, leading to the development of vaccines to control its spread and impact on the poultry industry. Marek's disease is a viral condition affecting chickens, caused by the Marek's disease virus, MDV, a type of herpesvirus. The infection process begins when chickens are exposed to environments contaminated with the virus, which is shed by infected birds through their feathers and skin dander. As infected birds preen themselves or simply move about, they release the virus into their surroundings, contaminating the air and surfaces with viral particles. The primary route of Marek's disease transmission is through the inhalation of these airborne particles. The dust and dander that chickens produce, now laden with the virus, can be easily inhaled by other birds within the same environment. This mode of transmission is particularly effective and dangerous because the virus can remain viable in the environment for extended periods, posing a long-term risk to any susceptible birds that enter the contaminated area. Once the virus is inhaled, it infects the respiratory tract before spreading to other parts of the body through the lymphocytes, a type of white blood cell. This systemic spread can lead to a wide range of symptoms, from tumors in various organs to paralysis if the virus affects the nerves. The widespread nature of this disease within the body highlights the virus's capacity to cause significant health issues and mortality in affected flocks. While the disease is highly contagious and capable of spreading rapidly within poultry populations, vertical transmission, or the passage of the virus from mother to egg, is not considered a significant route of transmission for Marek's disease. Instead, the focus is on environmental contamination and the inhalation of infected particles as the primary concern for the spread of the disease. Control measures against Marek's disease heavily rely on vaccination, which has proven to be an effective method for reducing the incidence of the disease. In addition to vaccination, implementing strict biosecurity measures is crucial for minimizing the spread of the virus. These measures include maintaining clean environments to reduce the amount of infectious dust and dander and implementing quarantine procedures for new or returning birds to prevent the introduction of the virus into healthy flocks. Marek's disease, a viral condition affecting chickens, is caused by the Marek's disease virus, MDV, and is known for its wide range of symptoms, which can vary in severity and manifestation. The disease primarily affects the nervous system and can lead to the development of tumors in various organs, impacting the overall health and productivity of the birds. One of the hallmark signs of Marek's disease is paralysis, which can manifest as an inability to properly use one or both legs, or a wing hanging down, indicating the virus's impact on the nervous system. This paralysis often appears asymmetrically, affecting different parts of the body to varying degrees. Alongside these neurological symptoms, Marek's disease can cause tumors to form in vital organs such as the liver, heart, spleen, and kidneys. These tumors can be either visible or internal and contribute significantly to the decline in a bird's health. Vision impairment is another notable symptom associated with Marek's disease. Chickens may develop irregularly shaped pupils or become completely blind due to grayish-white masses forming on the iris or within the eye, a condition referred to as ocular lymphomatosis. This aspect of the disease underscores the virus's ability to affect multiple body systems. Affected birds often exhibit significant weight loss and a general deterioration in condition, despite maintaining a normal appetite. This decline is a direct consequence of the internal spread of the virus and its debilitating effects on the chicken's health. Respiratory symptoms, including labored breathing, may also occur, especially if tumors develop in the respiratory system or if there is an accumulation of fluid in the lungs or air sacs. Additionally, some chickens may experience diarrhea, further contributing to their poor condition and weight loss. The disease also has an immunosuppressive effect, leading to lethargy or decreased activity levels in affected birds and making them more susceptible to other infections. The diverse clinical presentations of Marek's disease, ranging from neurological symptoms and tumors to vision impairment and immunosuppression, make it a particularly challenging condition to diagnose based solely on symptoms. Laboratory tests are often necessary to confirm the presence of the virus and to differentiate Marek's disease from other conditions with similar clinical signs. Marek's disease, a viral infection affecting chickens, poses significant challenges for poultry producers due to its highly contagious nature and the absence of a cure once birds are infected. The cornerstone of managing Marek's disease lies in prevention, with vaccination being the most critical component. From the first day of their lives, chickens can be vaccinated to significantly reduce the severity of the disease. Although vaccination does not prevent the virus from infecting birds, it plays a crucial role in preventing the development of clinical signs and tumors associated with the disease. It's important to recognize that vaccinated birds may still become infected and shed the virus, but the vaccine greatly mitigates the impact of the disease. Beyond vaccination, stringent biosecurity measures are essential in preventing the introduction and spread of Marek's disease. These measures include limiting access to poultry housing, enforcing robust cleaning and disinfection protocols, and ensuring that new birds are quarantined before being introduced to the flock. Such practices are vital in maintaining the health and safety of the poultry environment. Management practices also contribute significantly to disease prevention. Providing a clean, stress-free environment, ensuring adequate ventilation to minimize the presence of dust and dander, and maintaining optimal bird density can all help in reducing the risk of disease spread. These practices not only contribute to the overall well-being of the chickens but also reduce the likelihood of Marek's disease transmission. Selective breeding for resistance to Marek's disease is a longer-term strategy that involves developing flocks less susceptible to the disease. Some chicken breeds exhibit a natural resistance to Marek's disease, and selective breeding programs aim to enhance this resistance, offering a genetic solution to disease management. Environmental management, including regular cleaning and disinfection of premises and equipment, plays a pivotal role in controlling Marek's disease. Given the virus's resilience in the environment, complete eradication is challenging, but reducing environmental factors that facilitate virus spread, such as dust and feather dander, is crucial. Regular monitoring and surveillance of the flock enable early detection of Marek's disease, allowing for the isolation of affected birds. While this does not cure the birds, it helps to minimize the virus's spread within the flock, protecting the health of the remaining birds. In essence, the management of Marek's disease in poultry flocks revolves around proactive prevention through vaccination, strict biosecurity, diligent management practices, selective breeding for resistance, environmental control, and vigilant monitoring. These strategies collectively help to mitigate the impact of the disease, ensuring the sustainability of poultry production despite the challenges posed by Marek's disease.